Hey folks, it's Dr. Mike, and we're back here again to continue our series, Medical Exercise Training, the New Modality. With this video, we'd like to talk about this new fitness approach. Now, in our last video, we talked about the mandate for change, and we talked about the wasted billions in attempting to manage these chronic medical conditions, but not including exercise in the process. So this new fitness approach requires that we have specific functional outcome measures used to gauge the effectiveness and the progress of the exercise programming. Examples would be things like blood pressure and A1C values. We also must have a protocol-based approach containing specific exercise progressions, documentation, and communication guidelines designed for each individual medical condition. We can't shotgun it and have one approach to all conditions, all cardiovascular, all orthopedic conditions. It must be specific for each individual condition, just like we see with the treatment of certain medical conditions with physical therapy, occupational therapy, surgical services, or medical therapeutics. Along with that, we must have specific finite guidelines on frequency and duration with regard to the delivery of medical exercise training services. And folks, this is a huge shift for the fitness industry. No longer can we just simply have the client coming for years and years. And yes, some clients do need to come for years and years to control certain conditions. But with that, we need to have functional outcome measures and specific guidelines on how often they come, how many sessions they're coming for, and use those numbers to actually determine what type of numbers we're producing as far as improvement in the condition. Now, the clients, once they finish with medical exercise training and now they've been stepped down to a lower level, they can continue to come and maintain their level of fitness. But we need to make sure in the early stages, as they're going through the medical exercise training program, we have finites regarding frequency, duration, and the number of sessions. Then also, we must begin to engage these clients in home exercise and lifestyle education. Lifestyle education, folks, is going to become a much needed component or role for the medical exercise professional out there, because as we're seeing more individuals enter the healthcare system and they're entering now older, they have more chronic conditions, the need for lifestyle education and home exercise will grow exponentially, just like the number of clients will grow exponentially. With these functional outcome measures we're talking about, it includes things such as glycosylated hemoglobin or A1C, blood pressure, blood glucose levels, bone density levels, range of motion, muscle strength. The functional assessment scales will be another tool we'll use to determine if the client's exercise program is effective or not. Cholesterol levels. Now, obviously, some of these outcome measures will need to be measured or ordered by physicians. But the physician ordering that information and that information being shared with the medical exercise professional now allows us to have a better idea and better collaboration with the medical community, and also helps the client to determine if the exercise is working or not. Things such as pain scales, anthropometric measures, resting heart rates for certain conditions, even body mass index are just some of the functional outcome measures that we now need to start to adapt and utilize in the fitness industry, particularly in this new and growing area, medical exercise training, the new modality. Now, medical exercise training is beneficial for a wide range of medical conditions. Over the last 25 years, our medical exercise specialists on 6 continents have worked with hundreds of thousands of clients, and this is just simply a notation of the conditions that they work with over the last 25 years. And yes, folks, they've actually shown that we can see improvement with these functional outcome measures with finite specific exercise programs that are based on medical exercise protocols. So again, if you want to join this movement to bridge the gap between healthcare and fitness, you're a fitness professional out there that wants to start bridging the gap, please contact us at medicalexercisetraininginstitute.com. If you're a physician or medical professional, or even a client suffering from a chronic medical condition, please contact us so we can connect you with a medical exercise specialist, plus rehab conditioning specialist or medical exercise program director in your community to help you now start reaping the benefits of exercise with regard to managing chronic medical conditions. Thanks again. We'll have another video, and we look forward to you joining us for our next one. We appreciate your time.